Somebody told me that I could become a nurse practitioner. There was a physician shortage, and then they asked nurses in that time if they wanted to step up and fill that shortage. Nurses said, well, we can do it ourselves. And we did. I had a dream, showed up to work, and I didn't have an office. I was starting to ponder this sort of nudge that I was feeling, just do it on your own. Was I actually going to be able to pull it off? Could I do it? I kind of had this statement in my mind that I read somewhere that a business, you need to wait 5 years if you really want to know if it's going to fly. I kind of hit a goal where I see patients 1 day a week and the business is running and making money whether I'm here or not. To deliver unparalleled integrative care, bridging mainstream to family medicine, to naturopathy, anthroposophic medicine, and indigenous wisdom. Feel the nudge, then you should explore it and just go for it.
Welcome to UNSUNG, the podcast powered by Duet, where we shine a light on the nurse practitioners who are breaking barriers, redefining healthcare, and proving that NPs aren't just the future, we're the now. I'm Dr. E, and in each episode, we'll uncover the untold stories of NPs across the country who are changing lives with their practices, making a real impact in their communities. Today's guest is Julie Foster, an NP, a visionary who followed a spiritual nudge and turned it into something extraordinary. She's the founder of Kohala Clinic in Portland, Oregon, where she's been delivering integrative and primary care and oncological care since 2007. With 26 years of clinical experience, she now has this clinic for 18 years. She's not just healing individuals, she's transforming her entire community. In this episode, we dig into the dream that started it all, how she built a reputation rooted in empowerment, and what it really means to bring soul and science together. Let's dig into it. Julie Foster, I am so excited to have you here.
Thank you. Thank you for asking me.
Of course. So, this podcast is for either people who already have their practice or are thinking of their practice. But before we get to your practice, we want to know what made you decide to become an NP to begin with?
Oh, that's a good question. When I was done with my undergraduate nursing school, I really felt I wanted to go to medical school. And so I was working ER trauma for a while and I was getting my prerequisites. And then somebody told me that I could become a nurse practitioner. And that made sense to me to come through that doorway into nursing and medicine in the way that I am now because of the foundation of nursing, health promotion, and prevention. So little did I know it was a bit controversial.
When did you discover that?
I think halfway that first year of my program, looking at the history of how nurse practitioners were set up, and that maybe it wasn't so favorable compared, physicians. I don't want to, be negative about it, but there was this idea that there was some perceived threat.
Yes, of course.
And I think the history that I recall is that there was a physician shortage, and then they asked nurses in that time if they wanted to step up to fulfill that shortage, but it was the time of the women's movement. So nurses said, well, we can do it ourselves. And we did, right? So
I love that so much. So, okay, so you started as an NP. What prompted you to make the crazy, insane move of opening up your own practice? What were you doing before?
I was working with some osteopaths who were holistic, and I just felt that I wanted to delineate myself apart from that and kind of just make something unique my own, so that rather than being an assistant to the practice, and so that seemed to get in the way. And I had a dream actually.
What's the dream? What was the dream?
That I showed up to work and I didn't have I didn't have an office and I couldn't work there. And that and it actually came true. I came to work and because initially they had me in the room with the medical assistants charting, and it was like this really busy room. And I didn't complain about it, but it was interesting. They put me in a different room, but they didn't tell me. And so I just kind of saw that because I was starting to ponder, this sort of nudge that I was feeling of just do it on your own.
So you had this little this intuition, and then this kind of symbolic thing was like, that's it, I gotta go.
Uh-huh.
I love that. Did you immediately pivot, or did you stay on for a while and then opened it slowly? Like, what was the move?
I gave a 90 days notice, and
Okay.
I was working with some mentors at that time, and I just felt empowered to do it.
Nothing
But
like
I
a good
also thought
mentor.
it was really crazy because why would I want to enter into all this work, and and that my job was actually pretty okay, and I had small children at home.
Yeah.
So there was this voice like, you need to do it. And so I just went for it. Started gathering all the information I could, getting my list together, talking to people, finding a place.
So you did it all in 90 days?
Yeah.
Okay, so in 90 days from notice to open practice, got a spot. You didn't get fully credentialed in 90 days.
Well, that's a hiccup because I was naive.
Yes.
I was
So,
checking about what plans I was on at my current location, and the advice I was given by the phone was, "Oh, you just need to change an address." Well, no, you don't.
well, no, you don't.
In addresses, but you have to have your own tax ID number,
Yes.
not using the old one. So that was a faux pas and a challenge in the beginning because I saw patients with a couple plans who I thought, and I had to write off $25,000.
Oh, yeah, because it went somewhere else. Yeah. It's really interesting. I'm glad you surfaced that. Thank you for being honest about it, because people are always asking, well, what do you do? What do you do? And I'm like, listen, just start, because you have to make the mistakes. None of us know what we're doing. So you started thinking you had credentialing. I didn't even know what credentialing was. I think the first 6 months, I just photocopied people's cards. I didn't even know what to do with them. I opened it not even knowing that credentialing was a thing. Okay, you want to talk naive, and take it a step back. At least you made that call. So, and it's okay. And like, look where you are now. So anyone listening, there is no game plan. There is no rule book. We all kind of figure it out, make a lot of faux pas, as you called it. And I'm really glad that you surfaced that story, because we have to normalize for the younger ones coming in that we don't know what we're doing. And that's okay. And we learn it on the go, and then we become better at it. And then we teach, others, and then you find networks, but no one knows what they're doing. So I love that. So in 90 days, you basically get a spot, but you're not credentialed. So you're like, you have some patients, you think you're killing it, but then you find out that money's never coming to you. Is that what happened?
Yes, yes. But there was this other synchronistic thing happened. There was a death of my friend, and I was at a
Sorry.
funeral, and her mother said, "Oh, you're starting a new practice. My other daughter is a biller, and she can credential you." So then that word credentialing got put into me. And
Wow.
so meanwhile, that person, you know, I went out the gate, and that person was giving me my credentialing packet, and I was like just filling out things she told me to fill out, and she was getting me on all the plans.
Love that. That is like such divine intervention. The
Mhm.
universe was like, let's go, let's go. So you started, and how did you, I mean, I imagine like everyone, the first few weeks or months, pretty empty?
No, for me, I had the place that I left, I had like 600 patients.
Mm.
I wasn't able to take the charts. And so even before I started, I was penetrating my network. I put out a letter even to my husband's aunt. I just put it out to let the universe know I am doing this, whether I expected certain people I was notifying to be my patient or not. So
Nice. So when you
I,
opened up, you already had people on schedule.
yes, yes.
Love that.
Now I wasn't full, but it was very legitimate.
I love that. How many years ago was this?
18 years ago.
18 years ago. So back then, see if you could channel back then, what was like the biggest concern for you when you first started?
Was I actually going to be able to pull it off? Was I actually going to be able to fill up the schedule? Could I do it?
Financially, you mean?
Financially, and, will I see enough patients to make it, uh, legitimate or an embrace practice? But I kind of had this statement in my mind that I read somewhere that a business, you need to wait 5 years if you really want to know if it's going to fly. So I was in that, okay, it's not 5 years yet. Don't make the judgment. I kept telling myself that throughout, like whether it have be a quiet day or not, or the problems I was facing. So
That's really good advice because, like, when you have a quiet day or a day of, especially in the beginning, or a day of cancellations or a day of no shows, you can certainly talk yourself into, I need to go back to working for somebody. But by giving yourself that 5-year window, um, and centering yourself on the bad days, that's really helpful because what you want to look at, right, is like this bird's eye view. But how am I doing over the year? And you kind of lose that sense on a bad day or a bad week. So
Mhm.
that's a really, really good advice. Like pull the camera out, take a look at it over the years, not over today or this week or this month. That's really, really good advice. So did it take about 5 years to get there?
I was steady in my increase. I have to say I had 3 small children at home. I was also homeschooling my children
Wow. Okay.
so I would homeschool in the morning, and then in the afternoon, I would do like a noon to 6 schedule.
Nice.
And uh, so, and I have to sort of preface too, I'm a second income. And
Okay.
so I had the freedom to do that, and I worked part-time. I didn't have like 4 days a week seeing patients. I was seeing patients like 2 to 3 days a week in the beginning. So
Yeah, and that's important to note. So you are second income, and so for some people who maybe are the sole providers, a lot of them what they do is they keep their full-time job, and then they do this as a second income until it takes off. And again, I'm glad you surfaced that because people need to know that it takes some time to build, and that's okay. We all, as we started, um, either depend on another job or depend on our partners. I depended on my wife for many, many years until it took off.
yeah, yeah.
Yeah, I
And
think that.
I also worked, I did a side gig of fueling it that way. So
Yeah. And I love normalizing that for people because I just recently mentored someone and they really were under the impression that they need to leave to start. Like, whoa, don't leave your job. You need to pay your bills. Stay open in the afternoons, the weekends until it takes off. And then you slowly go down to part-time. And so I
sure.
love I yeah, I love that. Or if you have a partner that can help you. Um I love that so much. So the first 5 years was really about, well, you said two things. You said, I'm worried about my numbers, but then you also said how to make sure it's legitimate. That seems to have been a concern for you. What does legitimate mean? That the community thinks you're as good as?
No, not as good at, well, that it had all the functionings of what a business, like running it like a real business, not just trying to patch it here and there, and that, like, I had just sort of this voice saying that, like, okay, you have all the foundation, the lattice of the business, all of it's, engaged and working. And so maybe the word isn't legitimate because I am legitimate from day one. Um, but I guess that's also the confidence. Like, I think being a brand new nurse, I wondered if the patients would kick me out of the room when I walked in. But
Yeah.
it's like it it really is both things at once. Like, totally had the confidence, had a patient base, was, 2007. I had already been a nurse practitioner for like 8 years or so. So it's like, or more. And I have to also preface, I had a short stint opening a private practice, like just 2 years being a nurse practitioner. And I
Yeah.
did, and my husband's job moved. So I only had that practice open for 2 years. And the startup cost for that was so small compared to this one. But it was like a practice run. And yeah,
Oh, I see.
I wouldn't advise someone to open a practice knowing that you're going to move in a couple years.
Yeah, I don't think that's great
Yeah,
advice. But it was what you're saying for you was a great mock trial.
exactly.
Amazing. I
So,
love it. So why were the startup costs so much here? What was it? Was it the
uh,
rent? What was it?
well, when I did my research and what I know is even today, like the average family practice, primary care, is 50 to 70,000 for that first year to protect. That was in 2007. Now it says like 50 to 100,000, but we didn't have like telehealth, and we didn't have like, maybe you don't have to have a brick and mortar for people coming on board now,
Right, right.
right? So that was basically renting a room and having like a cupboard of supplies and a table and a chair that spent that money that year.
Yeah.
So, and I think when I discovered that, that's another story of going, oh, well, I don't really have that. What am I going to do? I was already like found the place, and another naive thing that I did. Um, and then my dad said, well, your uncle in Italy might be able to help you. And it's like somebody I don't even really know. So my dad made me get on the phone. I played that card. I just said, I feel really weird asking, but I decided, well, if he said no, then that was my answer. I was just going to hold off.
And he
And
said yes.
yeah. And the thing that we had in common was we went to the same college, alma mater. He wanted to help people out. And he just said to me, what do you need? And I said, well, I think I can do it at 40. And he's like, all right, it's just a verbal promissory. Um, I'll send it. Where do you want it to go?
Wow. And I imagine you've paid him back since.
Yeah, I paid that back within like 3 or 4 years.
That's amazing. I love the idea of like, well, if you don't ask, you'll never know. Right. And that's in your case, it was money, but there's so many times people are like, oh, I don't know. Should I go into that cardiologist and ask him for referral? Probably already has a primary care that he refers to. Well, if you don't ask, you never know. Right. So that is really good advice. Like, what's the worst that could happen? You can say, no, you're in the same spot already as you were before. So that's really, really good advice. Okay. So the first 5 years you were trying to fill things out, you paid back within the 3 to 4 years. That's amazing. So then what happens? Are you still in the same location as you initially were?
No, this is my third location.
Okay. What
Uh,
prompts you to change location each time?
um, I think initially my patients, the demographic of my patients, I was having them travel just a little bit out of their demographic.
Hmm.
And also to tell you too, I was very humble about where I first set up my practice. It was like in a room in a chiropractor's office.
Sure.
Okay.
Because you're starting. It's
Right.
appropriate for the starting.
Yeah. My mom was off site with the phone, working her other job, we're just like, is this going to go? We're going to be able to pull this off. So, and then I moved, and then I lost that site for some, they sold the building, and then, so now I'm in my third site, and the third site,
Wait, you skipped to what happened to the second site?
well, it was near my demographic. It fit the need, but the building was like not as that. It was on a busy road. It didn't feel like when you were in it, like you could settle, like because you just
Okay.
a lot of busyness. And then they sold it, and then they had somebody owning it, so I had to find a new place about 8 years ago. So that was like also my 10-year mark, which is where my practice really hit strides and hit a threshold, I call it. Um, and so the only place I could find that wasn't like the cost that I could afford was actually a building with 9 rooms in it. And so I could afford it on my own practice. And then I thought, well, maybe things are better together moving forward with the way the system is, and maybe we can share expenses. Then that was my attitude. So I've been here for 8 years. Um, yeah, and it's in my demographic, and actually, it's in a place that I actually was born and where my dad grew up.
Nice.
All this, again, synchronicities on how I
Love
was
that.
be here. So
But also, what you're bringing to the table is, and letting people know, is that your first location is not your last location. Sometimes people really focus on, like, is it the right location? Just start. And what I recommend for a lot of people, take a room in a chiro's office, PT's office. There's already, like, they've already spent the money on making it look pretty, the waiting room.
it's
And
decent enough, and to take up big monies to rebuild out a site or a building that's healthcare offices that you have to build. It just I just didn't want to invest in something that
yeah.
was clean. And then being humble, like, yeah, it may not be the fanciest.
No, I think it's actually what I recommend for a lot of people. Start somewhere. I think co-sharing office is a great place to start. Less overhead. There's some traffic in there. People get to know you. And then later you can move, right? I think most of it, I moved to a different location too. And I think that's important to let people know. Um, so now you're in this location, and are you sharing it with someone else?
Well, I'm leading it. So it's not shared. I'm responsible for the site. And we have right now 8 other providers. At one point, I had 14, but I'm learning incrementally over time, how to manage all that and also what that really means. So,
Providers that all work under you, like in your practice?
well, originally they were 1099s, and I didn't like the idea of people under me, and I wanted it to be collaborative. But at the end of the day, I'm the one that has the skin in the game. They look to me like Mama Bear. So I end up having to adjust myself over time. So
So now they're part of the team, not as a 1099.
it's a shifting. So it's part and part, as we're not hiring any more 1099s from, well, at first I didn't think I could afford to pay someone a salary.
Right.
Where was that coming from? And I like the comment that every provider that comes on needs to generate their salary,
Yeah.
and you don't have to feel bad about it. And at first I worked so hard to get all my patients, and I thought, oh, they'd just be so happy that they can walk in and they have patients, but they're not entrepreneurs. So they don't see it that way.
Right, right.
Yeah.
It's true. It's true. Not everyone.
Excited, but they're like, hey, that's part, you're supposed to do that. And I was like, oh, okay. There's a couple that are what I call entrepreneurs, who are really for the mission, want to see us go forward, that are part of my leadership team. So
Yeah, that's really important too. So you have the NPs. How about your, like, internal leadership and your non-clinical staff? How did you get that team going?
it um it morphed over time. So I can say right now I kind of hit a goal where I see patients 1 day a week, and the business is running and making money whether I'm here or not. And that I didn't, you work it so hard, you're there every day, every nuance. And then I think that's not humanly sustainable. And so just in my personality, I think most entrepreneurs' personality, you're always visioning and wondering, how you can improve and new ideas and things like that. So I was feeling, it made sense. I did all that work at first, but now I'm untethered from that.
Yes.
And, but yet the mission and vision that I put in place, I feel really passionate about, and in building the culture and you talked about my leadership. So I have a longtime assistant who I made a clinical manager. Um, I had, I didn't have manager at first. So some of that, I was wearing all the hats.
Yeah, of course. In the beginning, you do everything.
Yeah.
Yeah.
So now I can say soundly there's 5. Well, we just added one more to the leadership team. And so there's 6 of them. I'm having one of the longtime nurse practitioners who stuck with me through a lot of things. He kind of just said, let me lead the meetings now and get these people and get these providers doing what they need to be doing.
That is great. That is nice.
So,
what is your mission? You said you're mission driven. What is the mission of the practice?
to deliver unparalleled integrative care. Originally just me by myself. I was Hala Place of Healing. That's the name of my clinic, bridging mainstream to family medicine, to naturopathy, anthroposophic medicine, and indigenous wisdom. That's really I bring being with my Hawaiian cultural spirituality and my faith-based approach. So I teach a lot about that in my practice with my staff and with my patients to have that nuance there. And then the providers, when they're being vetted, is checking with them. Okay, this is who I am. This is what I put in place. I want you to be you, but are you aligned with it? You need to be aligned with it, not just on a side parallel with it. And can you support that?
And so I get that some people could say, yes, I'm aligned with it, but I imagine there's certain training that they may not have.
And they don't know fully what it is. And so all my providers at least have to be integrative focused, that's what they're offering at the practice, that they're educating themselves, whether what we know today, we call it functional medicine, or in the just holistic health. And
so do they have to take courses?
They should have. So also half of my providers are naturopaths. So in the state of Oregon, naturopaths primary care providers. So I wanted naturopathic focus. And so to me, they're basically kind of have that foundation. And then the nurse practitioners, the ones that are with me, are people who care about lifestyle medicine. They care about the meaning of illness and being present to people. One's really into gut health.
Yes.
And so on and so forth.
Sure. Oh, that's great. That's great.
And I invite them to the trainings that I've been involved with. Like I do a lot of integrative cancer care and mistletoe therapy. So there's somebody who I'm training to be in my place now to grow that part of my practice too.
That's amazing. And what about the team culture? You mentioned something about culture. What is the culture that's important for you?
I've learned that, in retrospect and when I'm out in the world hearing about how people are very disgruntled about and create the we, they, and my boss, and I'm the worker. And I was like, I don't want that. How can we not do that? Well, one of the tenets around my practice is the aloha spirit. Universal. It's part of my culture. So right away, we have new employees. They and all the providers. I give a class on that, and I say that's the foundation of how we to interact. In the ohana, you probably have heard of that. It means everyone is family. And there's a polarity with that, because when you say you're part of family, it's not always fun and games. It's like hana means the work. So I try to preface like how to have an innate positive regard as a foundation. And then when a provider or staff is coming on and says, okay, since we are like family, you want to have to get to know everyone. You don't need to be their best friend, but we do things together. We have connection that is core. And this is what I have with my patients too. So, and our patients have a place of refuge, either as a location or within themselves. And we're also building that in our own selves. So I mentor and coach my staff, my providers around these concepts, but they don't actually have to sign up to say, I love everything Hawaiian. I'd like them, but this is the preface, and that what are they doing to improve themselves in their lives as life learners and their whole soul and spirit?
Oh my goodness, I love that so much. So that's like woven into your training and woven into your day to day.
Yes.
I
Yes.
love that so, so very much. Um, so what is in your practice, let's give some advice to our NPs who are listening. What is maybe a strategy or something that you've adopted over the years that has really been a game changer for your practice?
What comes to mind is I heard something where I accept that there's work to do every day, and that maybe there's just one day here and there where everything feels like it's perfect. So the strategy is to know that whatever we're working through, we get to work through it, and
Yes.
not to be. I used to take it personal. I think a lot of people who become nurses or nurse practitioners were very task driven, very want to do the best and be the best. And so we're going to get complaints.
Yes.
We're going to get things that we need to solve, and not to take it on, like, own your part of where you're learning and be humble and all that. But at the end of the day, it's like, so what? Yeah, it's the next thing. Just let's keep our sights on our mission and vision and what we're doing as servant leaders.
Yeah, I think it's a good point because sometimes I hear from people like, oh, it's like every day is something. I wish, can we just have one day? And the answer is no. This is the ebb and the flow of the practice. Like, get used to that rhythm. Because if you're looking for this moment of peace, I mean, like you said, you might have one day, God bless, amazing. But generally speaking, it's really a rhythm. It's not so much a balance and more of a rhythm. And you have to just kind of be willing to go with it. Get comfortable a little bit, uncomfortability, and kind of ride the wave. So I like that advice so much because if you keep looking for like that, if I just get this done, it'll be good. If I just get this done, it'll be good. You are constantly going to be disappointed.
So many branches of running a business that you just keep picking away at it,
Yes.
and not, sometimes you just say, I hit a max in the day, just talk to the hand and then get some sleep and then get back at it. I mean, it's really,
Yeah. Chipping away at it is really important. Like,
yeah.
we have like a constant evolving list, my leadership team and I. And in a sense, it's never ending. Uh, and you would think like, does this list ever end? So first answer is no, it never ends. But you chip away at little bits. Sometimes it's really important to work on the front desk, and sometimes it's really important to work on what's happening in billing, and then as soon as you went through all of it, you're starting all over again.
Yeah,
So
I mean, I think I'm pretty good intuitively know what comes to the surface,
yeah,
but yet you can't only rely on that in yourself when your business hits past the $1 million mark, or um let's say all your systems and processes break down and you have to have new equipment. I had to recycle out my manager. There's a lot of pain points, but also saying that's growth. That's just nature. It's our
yes,
physiology. We take something in, it builds it up, destroys it, sticks out something new, you
I
know?
love that so much. So looking ahead for your practice, what are your goals? What does the future look like?
We have a goal. So I would say maybe the pandemic, of course, was the pandemic. I think I was at a point where I was like, I can't carry it in the way I'm carrying it anymore. So now
Yeah,
that team of people, they're like, let's go for it. We want to do 2 or 3 more clinics because we feel like, well, after 18 years, we dialed in how to run a business, how to be in healthcare. So that's a goal before I retire. And so some days it seems like, am I even going to stay open, let alone do
it's so true.
all these things exist simultaneously, but all the while, because somebody might say running a business is in itself such a big deal. Then you add on that you took a business in healthcare. Um, but, there's a lot of complainers and negative nillies, but in the end, there's a lot of practices, especially nurse practitioner practices, that are thriving and making money.
Yeah, and impacting humans and stepping up when no one else is stepping up in areas when no one else is stepping into. But I love the honesty where you're like, still 18 days later, you have moments you're like, am I even going to be around anymore? Because there's that rhythm too, right? The rhythm of the cash flow. Sometimes you're like, oh my God, what's happening? And then other days you're like, sure, I can open up a second clinic. So that's another rhythm that you have to get used to. Feast or famine rhythm.
Yeah. I mean, I have this interface with myself of, whoever you want to call it, source, God, or anything. I'm just always in conversation. What's it going to be? What is, or sometimes I think, well, maybe I imagine having a job and I just, it's 18 years. I'm probably going to stay in it if I've stayed in it this long.
Oh, yeah.
And I keep choosing that over and over. It keeps choosing me.
Yeah, that's a really good point. On the tough days, my wife, she doesn't need to say it to me anymore, but in the beginning she'd say, well, do you want to go work for someone else? And I'd be like, absolutely not. And then I would just jump right back in. So I choose it each time, even on the hard days. You're 100% right.
Yeah, kind of like it's your house, it's your dirt. But,
Yep.
But truthfully, I have to coach myself. Really, what am I in the moment feeling so fixed about? But then list all those gratitudes.
The gratitude really, really helps finding the moment. And, I was just coaching someone on my team this morning. She's like, people are always screaming. And I said, well, first of all, definitely not always, probably like 80-20, right? So we have 80 people who are either neutral or really grateful, and taking a moment to acknowledge those patients, like a reframe, is really important. And taking a moment to appreciate how often we impact people so greatly, right? They go home and talk about us and say, wow, this person really helped me get whatever. Everyone, front desk, the tech, everyone has a moment for that. So taking a moment to be grateful to be in that position, and also a moment to be grateful to be in the position of giving and not having to receive, I think is really edifying. And it helps you get through that 20% of the complainers and the screamers. Yeah. So connecting to source and connecting to gratitude is so helpful in every way. So I'm so glad you mentioned that. So what's a fun or a surprising thing about you that most of your patients or maybe even your colleagues don't know?
I was laughing about this when I saw this question. With my children, I dance Tula and Tahitian. And I think because I'm really very serious, people don't expect that.
Wow. Oh, that's a good one. That's amazing. So as we wrap up, any last words of advice for any NP listening?
Feel the nudge, then you should explore it and, connect in with your mentors and just go for it. You do have people out there once you blend into it that that's been real key for me. And it helps you grow. So.
Yeah. So just jump in if you feel the nudge. I love that so much. Julie Foster, thank you so much for being with us today. That's a wrap for today's episode of Unsung. If this inspired you, share it with another NP who needs to hear it. Don't forget to subscribe and leave a review. It helps more NPs find us and fuels the movement. If you want to join the largest NP practice network, learn more about Duet on our website, joinduet.com. Until next time, keep pushing boundaries and proving what NPs can do.